Hi, everybody. Welcome back to Behind the Scenes in Health podcast, where we uncover the stories of healthcare professionals who are shaping the future of medicine and beyond. And today I'm truly excited to sit down with Dr. Uwa, who is a GP, he's a family physician, educator, research lead, and also a council chair at the Royal College of General Practitioners here in the UK. So his story is actually an inspiring one from Nigeria to UK, filled with challenges, resilience. And we'll be exploring all of that in this episode. We're looking at his paths, the highs and lows, the lessons he's learned, and probably his vision for the future of family medicine. So whether you're a clinician, you're a trainee, or just simply curious about what it takes to lead in healthcare, I believe this episode is for you. So let's dive into the conversation. Thank you so much, Dr. Wa, for joining us on today's episode.
Thank you, Dr. Ron, for the invite. I'm glad to be here.
So I typically like, starting from the beginning. Where did it all start? So can you just, touch a bit about what your early life looked like and what medical school was like?
So if we go straight to the beginning, I was born in Benin City, now Edo State, Nigeria. I born and grew up there, went to school, and went to boarding school in Warri, Federal Government College, Warri, then returned back to my state of origin, and I attended University of Benin medical school.
The great UBTH.
The great UBTH, great Uniben, yeah. Our medical school was interesting, obviously had its challenges. Obviously, you have your whole first MB, second MB, WOCO, and all that business. But it was really interesting, made lots of friends, joined the fellowship, and it was quite supportive as well. I really enjoyed medical school, even if it was quite hard sometimes. What I found important and useful was having sort of friends or colleagues who you can sort of spur yourselves on, particularly around exam season.
Mm-hmm.
So I went to University of Benin, and that was where I got my medical degree from.
So at what point did you now, think, okay, I need to move to the UK or somewhere else to continue my career?
That's an interesting point and question. To be honest with you, during medical school, I don't think I was seriously considering it, which is interesting. But obviously, the way the landscape was going at the time, particularly graduating during youth, during housemanship, and then getting to youth service, so colleagues, friends were already saying, to start considering moving abroad, or continue your postgraduate training. So obviously the States was an option, UK was an option, and somehow, some people say as God we had to have it, but luckily, unluckily, I stumbled upon this, HSMP pathway, highly skilled visa at the time, which eventually became tier 1 and all that business. I seriously explored that, and the rest is history, they say.
So what were your first impressions about the UK healthcare system, when you just came in?
Yeah, so I'll go back a step, which obviously contributed to me coming to the UK. My fiance at the time, she came here a year before I came to do her master's program. So I think somehow we felt we will consider it. Obviously, there was a consideration that she would come back to Nigeria and all that stuff. But that kind of also helped to sort of cement our path, to be honest. So coming over again, it was a case of how do I get started? What do I need to do to start to get used to the system, particularly practicing medicine in the UK? Again, I found that having friends, peers, colleagues, having a community was quite important. So clearly did all the PLAB too and started off with non-training jobs. And obviously that initial shifts that you take on. Thankfully, it wasn't a night shift. So started off, but it was a case of, it was a day shift, it was a day job. It was a case of asking questions. And I would never forget. The first thing I asked was, how do you prescribe Piriton? How do you prescribe Piriton? I asked the nurse, and I think she showed me or referred me to BNF or something like that. I will never forget it. But that was my first exposure.
That's quite interesting. So moving to a new country, we know it's not an easy, journey or leap or movement. So let's look about how you sort of navigated the early challenges you sort of faced when you came in. So what key challenges would you say moving from Nigeria to UK did you face, and how did you sort of navigate those shifts?
So there's a lot of challenges, obviously, when you move to a new country, wanting to either start off or things like that. I think I was quite fortunate and lucky to a large extent. Like I said, my
Okay.
fiance came before me.
For
So
you, yeah.
I had a little bit of soft learning with regards to getting accommodation, rent, even registering your name on the electoral register and all that kind of stuff. She did all that kind of stuff. But I think one thing that really rings true to me was about the financial system here, particularly the credit system. So having a credit history for you to be able to either get a credit card or get a mortgage, so that was completely foreign to me. In my mind, I was like, okay, you start earning salary, you walk into a shop and you just get anything you want. But I was so surprised. There was something we wanted to get. We had the money to get it, but because it had to be on a either payment plan or something, it was declined. I was like, I have the money. I'm like, why is it not, why is it not going through? So small things like that was quite important. Obviously, the weather change was a bit of a shock to the system.
Mhm.
That took me time to acclimatize to, just, dressing warmly and things like that. Yeah, so those are some of the things I think I
So, I mean,
encountered.
you mentioned, asking how do you prescribe puritin and all of that. So, looking back, were there any sort of moments where you sort of doubted why did I actually make this move? Or maybe you faced a major obstacle that like left you questioning why you made that transition or leap.
Yeah. Now, to thinking about that, to be honest, if I was to have think back and see whenever I thought that, it would be before I got my GMC registration,
Yeah.
because I initially did PLAB 1 back home and I wasn't successful.
Okay.
And then I came over without any PLAB exams in my bag. Somehow I was able to meet the points and come over with the highly skilled visa.
Yeah.
So I had to be working some like non-medical jobs, just doing
Roles.
stuff, on the street, not on the street, but on the street, which I think many of my colleagues had to do whilst you're preparing and, trying to pass your PLAB exam. So I couldn't really, I knew that I would try my best and hope for it, but I couldn't see it. Okay, I couldn't see, okay, practicing in the UK is not going to be that straightforward if I have to work and study for the exam. But thankfully, once I got the GMC registration and I saw the difference and how forward thinking and progressive the medical healthcare system was here compared to back home,
Yeah.
I think I was really grateful that I was in the system.
Interesting. So now you've held like multiple roles in the NHS, right? Which ones would you think shaped you the most?
I think my involvement with the Royal College of General Practitioners has shaped me the most, which in a sense, some may argue is not really in the healthcare system, but actually
Yeah.
it is, because you're dealing with colleagues, you're dealing with policies and things like that. And it was an interesting journey, to be honest, liaising with colleagues and just seeing how you could get involved. Many of the roles which are volunteer roles, but you can just see the impact that you're making both amongst colleagues within the organization and the impact that people who are watching from outside
Yeah.
are, are seeing. So I think that's what I would say.
So let's unpack this a bit. Like, so looking at the Royal College, right? You're a member and you're a chair. So how did that journey begin, really?
Yeah, really, really good question, and I'm really glad to share it again because I've shared it a few times. So I'm currently the chair of the Northwest England faculty. Okay,
Okay.
so the Royal College is obviously the whole UK, and then we have faculties that are distributed regionally. So I'm part of the Northwest England faculty. Okay, going back when I qualified, became a GP, I just wanted to be on my own, just stay in my own corner, qualify as a GP, do my thing, work, pay my mortgage, and just don't get involved with things, which I was doing. But I think it was around just getting onto COVID and the whole pandemic and George Floyd incidents, all that kind of stuff. So something just sort of ticked within me that this might be a good time to, come out of your shell, so to speak.
Yeah.
So the college were doing, certain meetings and forums, which I got involved with. There was a thing about bringing out a BAME action plan, which is BAME colleagues action plan, which is now sort of EDI, an EDI initiative. I got involved, just said, it was on Zoom then. So I just started again. And then someone mentioned, are you involved with your local faculty yet? And I was like, not yet. So I started attending meetings, my local faculty, being consistent. And then there was a position available to be deputy council rep. So a council rep sort of represents the faculty at the main council meeting at the national level. So I was the deputy at the time, kept going. I wanted to be involved with sort of organizing events for early career GPs. I got involved with that. And then obviously every year there's council elections where there's a nationally elected council members. So through my hat in the ring as well. And luckily I got elected. This was 2021. I was on the, so locally I was on the faculty board, as those things I said. And then nationally I was a council member of the college. So, I kept going. And one of the things that was driving me was to increase the representation of Black and Asian doctors or GPs on forums like this, which I want to believe I have achieved to a large extent. So, cut the long story short, being really active in the faculty, at some point I became vice chair of the faculty. And just last year, September, I became chair of the faculty, which has really been an exciting experience.
So looking at the journey sounds very straightforward, but I know it's not that straightforward, right?
Yeah.
So along the line, what challenges did you face, getting to this step or this position?
Okay, so I think when you come out of your shell and you start getting involved with things, you start to doubt yourself, don't you? You start to feel like, should I be here? Am I going to be able to contribute? So you join a meeting where you have very experienced colleagues who know a lot about the college and the faculty, but it was really nice and kind of them, to be honest. It was a really inclusive forum, and everybody is invited to share and say what they think. And I think that was a really good culture, and that really helped. So just doubting yourself, thinking, should I be here, and all that kind of stuff. Another thing that helped was colleagues, people who sort of either mentor you or inspire you, who had done something similar maybe the year before. And you're like, actually, if they can do it, I can. And then you obviously liaise with them. What did they do? What should I do? And so I think the main challenge was just doubting yourself and thinking, should I be here? Should I be doing this? Do I belong? Stuff like that.
Yeah.
But luckily, because of the manner of the way I approached it, consistency is important. That builds trust. Understanding what needs to be done, particularly with regards to becoming a nationally elected council member. I think putting myself out there, posters and stuff, I think all that helped me to just become sort of elected and get into those sort of positions.
So what does your day-to-day look like as a council chair? What do you actually do?
Yeah. So I'm not a council chair, Dr. Ron. So I am a council member.
Okay.
and a faculty chair.
Faculty chair, yeah.
Yeah. So it's really interesting. So as a council member, you're expected to attend at least three out of the 4 council meetings a year. So council holds a meeting 4 times a year down in London. So I'm up in Manchester, down in London. Sometimes you can attend on Zoom. And then separately, the faculty has its own faculty board meeting 4 times a year. Obviously, in between, you have to prepare for meetings, plan events, member engagement, things like that. On the national level, you could join 1 or 2 committees, depending.
Okay.
So that's kind of what it entails.
And how do you sort of manage this with your life as a GP?
That's a really good question. And my wife asks me this question all the time. I don't know. I don't know how I do it, but I kind of do it. What I found, particularly this past 1 year, being the faculty chair, what I have found is you don't have to be the one to do everything. That's really important, particularly with leadership, and obviously your style of leadership as well. I have a fantastic team on our faculty board and the exec team. We've got really good administrative staff and regional engagement manager. So that's one thing. You don't have to do everything, if that makes sense. Aside delegating, you're sort of encouraging and empowering your board members, if that makes sense.
Yeah. Okay, sounds cool. So now you talked about mentorship, right, along your journey. How has I know you do a lot of posts. I see your LinkedIn posts, very heavy on mentoring, mentorship, and all of that. So how has your approach to mentoring sort of evolved now that you're in leadership position?
So again, I think it's still evolving and we're still on the journey of mentoring. Just going back a bit, I think one kind of formal way I got involved with this was we have the Nigerian GPs UK Association,
Okay.
which then set up like a mentoring platform or a mentoring committee, which I joined. So we wanted to mentor directly Nigerian GP registrars or those of Nigerian origin, just to, so we just provide our contacts, and if they have any issues or problems or questions, we would address it. That was one of the formal ways I got involved with it. There's also Nigerian doctors in the UK, which you're aware
Yeah.
of. And so that's not just for GPs, that's for everybody. So I'm
Everybody. Yeah.
also involved with that. Really glad to help. I mean, the main thing is literally showing others, for lack of a better word, who are coming behind you, what you've already done and how you did it, and that you're available to help or show them the way. That's kind of the way I see mentoring. Some people would say pulling others up as you climb.
Yeah.
So, really key themes, and also some would say paying it forward. So you've achieved something and you would like to help others to achieve it. So at the moment, I obviously have some people I mentor, sometimes around exams, sometimes around GP training, also some sort of newly qualified GPs as
Mhm.
well. But what I'm now trying to do is similar to the being on faculty chair, is delegate, but not delegate, but trying to link up colleagues with other colleagues that would be useful to help them. And like I said, we're still on the journey of mentoring. We'll see where we go with it.
Get to that with that. So if I was like maybe a freshly qualified GP or just a doctor really, and I'm probably aspiring to get into some of these leadership positions, what advice would you give me?
Yes. So again, really topical and useful. So I just put together resources of leadership opportunities for
Mhm.
IMGs, and I can share with you on, maybe later. Literally just pull from here, things like that. And then not just leadership, but things like fellowship and even entrepreneurship type things that are available. So this is another thing I do quite a lot of. I find a resource that's really helpful and I share with colleagues, or I share on a platform, or I share on a group, which is sometimes really timely. You can apply for this stuff like that. So in fact, someone even reached out to me after I sent it, and I think it starts with what you want, because yes, it's good to aspire to be a leader and all that kind of stuff. So it starts with what you want, and is there an impact you like to make? Is there any changes you want to make with either within your own local system or regionally?
Yeah.
So it will start with that. But for instance, what I tend to advise for those, for instance, who are in the GP profession, either as a trainee or what I usually say, start to attend your faculty board meetings, because that's the way I started, and it's kind of panned out for me. So that way you start to have an idea of what works locally, regionally, and even nationally. So exposure and linking up with forums like this is important. Yes, courses and training will come up, but it all depends on your specific sort of intention and aspiration, so to speak. But yeah, there's a lot we can say on that, but I'll just leave it at that for now.
I think that's a good summary of how, understanding the why and what kind of
Yeah,
impact you want to make, then
yeah.
following that up.
Build it from
So
there.
interestingly, you're also a GP educator. So what does that actually mean, and what do you do as a GP educator?
That's another interesting one. And I've tried to summarize my medical education career as a GP educator. That
Yeah.
might change tomorrow. So going back, so again, when I qualified, I just wanted to, like I said, just do my own thing. But I started to think about medical education, particularly because a colleague was involved with the specialty. So then there was a GP specialty training recruitment stage. So first stage was your document, second stage you do an exam, third stage you actually attend. It's like an OSCE, but not really. So he
Okay.
was an assessor on that one. So that's been phased out now because of the pandemic, and now they do just the MSRA or whatever. And
Yeah.
so he said he's doing that. Somehow we got talking, and then I found out about my own region. I got into training to do that. So I was a GP assessor for that recruitment thing, but I only was able to do one round because of the pandemic. So I started to think of um, ways to, just how else can I get involved with that. So during the pandemic, I also work in the out of hours. So they were asking for clinical supervisors for GP trainees in the out of hours setting. I put my hat in the ring, got trained up for that. So I did that. I do that as well now. I knew at some point I'll become either a clinical supervisor or a GP trainer, which I've started the journey now, actually. Okay, so that's mainly on the postgraduate side of things. So I also like the whole university side of things. So I'm an OSCE examiner as well. So I found my way of getting trained up for that. So I do examine sort of year 3, year 4, year 5. And then just recently last year, I got involved with advising medical students. I'm a PPD, which is personal professional development, academic advisor for year 3 to year 5. So just wrapping all this in one umbrella, I just said GP educator, but I do like to support both undergrads and postgrad colleagues, which I'm doing at the moment.
So, I mean, listening to you talk, from the council stuff, now we're adding the GP educator one, and I'm also thinking of your clinical work by the corner. How are you able to manage all of this?
Yeah, so I'll tell you a short story on somehow how I tried to curate all of this. So I attended an RCGP webinar a few years ago, and Professor Mayo Lakani, which was the previous chair and previous president of the college, gave sort of a rough guide on how you could curate your career. Now, to me, this is fairly box standard, to be honest, because there's 1,001 ways you can curate your career. Like obviously, listen to your podcast and all your other guests. This kind of resonated with me. So he said the clinical, which is like you mentioned, your clinical work. So if you want to do special interest, that's fine. But your day-to-day clinical work, then your medical education, which is kind of what I've touched on. Then your leadership, which is kind of what I've touched on. And then finally, depending on if you want to get involved, is research. So this has guided me over the past few years, actually. I've only recently just started touching on the research aspect, which was last year. So clinical work, I've got a contracted 3 days a week at the practice as a GP. And then my out of hours work is mostly on the weekends. Sometimes I do a shift. Other times I supervise the GP registrars. And then somehow in between all of this, I try to fit in the medical education aspect of things and the college and RCGP stuff somehow.
It just feels overwhelming. Anyway, I figure you've got it all together, so I shouldn't even worry about
I hope so.
So looking at the educational side of things, so what's the sort of maybe one key piece of advice you probably give trainees, because you're constantly in touch with them, but at postgrad, undergrad levels, what's the key advice you probably want to give out to them?
So I think always have a learning posture, irrespective of what stage you're at, irrespective of how much you've learned or acquired. Always have that state of mind that you want to learn and you can actually learn more. Now, most importantly is how can I give back? Yes, I've learned, I'm achieving, I'm progressing, but yes, even if I'm young or junior, but how can I give back? What can I teach the next person? I think those are quite, important.
So if you're a trainee listening or watching, I believe you heard that. So have a learning posture. I think that's also one key advice for myself anyway. So beyond clinical work, you mentioned that you've started dabbling into research recently. So what's the push into research?
So research, like I said, I mentioned those 4 pillars, so to speak. And I was like, it's about time we, figure out the 4th pillar, irrespective. So I've got obviously senior colleagues in the profession who are being involved with research. Contacted them, spoke to them, what's the lay of the land. But prior to that, there's some learning modules that you can actually do free with the NIHR. You just register on there and you just start learning, even if you're not actively involved, but you can start learning, getting your certification ready and stuff like that. So the aspect of research I'm mainly getting involved is mostly about research delivery. Which is trying to get my practice involved with research, but more so our patients involved with research studies, so to speak. Obviously, there's a process and procedure about that, which I have followed. So what I did was almost like a one-man army thing. Got all my information ready, did some groundwork, and then approached the GP partners and the practice manager. I said, actually, this is what I'm thinking. I did a presentation at our clinical meeting. And they're like, okay, why not? Let's go for it. You be the research lead. We'll support you. See how we go. So another important thing is to sort of contact and and register with they used to be called clinical research networks in the various regions, but now they're called the regional research delivery networks. So just say,
Okay.
we want to become a research active GP practice. What do we need to do? Had a meeting. So we're all on the network now. So
Okay.
it's now to signify interest in whichever studies you think you can participate in, or whichever one you think would be useful for you as a practice or your patients. So we're in the process of doing that now. So we're in the process of doing that now. As we speak, I think we might be signing up to one study that has to do with, I think, either DNA or genomic testing, something like that. Yeah. So
Okay.
we'll see.
So basically, you guys, maybe is there like a list of studies or stuff going on? Then, as a practice, you say, okay, we're interested in this.
Exactly. Yeah, exactly. But there's a list somewhere, but from time to time they would always email you as well that we have a study team, colleagues in Liverpool who are doing this study, and it's primary care based.
Okay.
If you're interested, fill this form, stuff like that.
Yeah. Okay, that sounds interesting. Hmm. Okay. So, and how have you found it so far? Looking at mixing this with clinical and research at the same time.
Yes, so I call it early days, and because it's early days, there's no set structure yet, particularly with time allocated or even any changes to salary, if that makes sense.
Yeah.
So those are the things hopefully we would try and fine tune
Yeah.
as we go along. Yeah. So at the moment, obviously, for instance, if I need a set time in my clinic or in my day to recruit patients, or consent patients to a particular study, I think we can pre-plan it. I can always work with the practice administrator and my practice manager and say, please, can you block off some time? So rather than seeing patients, can we do some research for that time? So like I said, it's early days. And there was one other one we signed up to, but that literally just had to do with us sending survey questions via
Okay.
text to our patients. So that
Okay.
didn't really require much clinical time. So it's an interesting journey. And like I said, it's early days. Maybe if we speak in a year's time, I might have
See where
more
you've
information for
gotten
you.
to, right?
Yeah.
So you also mentioned you're an examiner, right?
Yes.
So again, that's another hat you're wearing. So what does that look like really? And what area do you examine on?
Yes. So I'm an undergraduate examiner, and this hasn't come up, but I'm also a postgraduate examiner as well. So for the undergraduate examiner side of things, so you just get a form to fill out your availability. So when it's around the OSCE's time of the year and you've booked on, so you basically, they'll send you the materials and stuff like that. So it depends. It could be any station really. It doesn't have to be a general practice or your particular. So it could be any station because it's undergraduates, for instance. Yeah. So it could be COPD station. It could be UTI station, safeguarding station, stuff like that. And then you have all the materials, the criteria that you need to use to assess the candidates.
Yeah.
And you have everything there. Obviously, prior to that, we've had the training, the examiner training,
Yeah.
which I've done. I did a few years ago, and then I did a refresher training. So you have an idea of what the exam should look like, what they're looking out for, and the criteria, how to mark, stuff like that. So that's for the undergrad one. So luckily, I was one of the new MRCGP SCA examiners that were recruited last year. So again, that's also been an examiner. So we have the training, we have yearly mandatory training events.
Okay.
And then for each diet, we meet up, we plan, depending on if you're allocated to mark for that diet. So you meet up with your group of examiners and obviously go through the calibration process and all that kind of stuff. And you have, so many whatever candidates allocated to you, which you watch through. Again, there's a set criteria. There's, the calibration information which you've had, and then you sort of, mark and assess the patient against those benchmarked criteria.
Yeah.
So that's what it entails. Well, it's a bit flexible with both, to be honest. Obviously, the first one is in person. So you can take either study leave or annual leave to go into the either the hospital or university to do
Yeah.
that assessment, mostly hospital. And then for the other one is now remote. So for the MRCGP one is remote. So you can kind of fit it around your own time, aside the actual meeting itself.
Interesting. Okay. So I think the interesting thing I picked from this was, sort of depends on your availability. So they send you stuff, then you
Yeah,
check and you say, "Oh, I'm available." You sign up. If you're not,
exactly.
you just decline and move on.
100%. Yeah. For the MRCGP one, I think they would expect you to, I can't remember the thing that they might say, try and be available for, I don't know, maybe 3 or whatever a year. I'm just throwing out numbers
Okay.
there. I can't remember. So that's for that one. But for this other one, if you're really interested to stay involved with undergraduate education, it would be good to keep doing something at least regularly. But there's no set criteria. If you're not free this year, you could just say you're not free this year, for instance. But
Right.
for the postgraduate one, for you to maintain that,
Yeah.
yeah, your examiner license, so to speak.
And is this paid or also volunteer stuff?
So it's paid. So it's
Okay.
paid. The postgraduate one is paid. The undergraduate one is paid, but in some universities it's not paid. And so it's an interesting one. So even some registrars or other resident doctors who are not GPs, I think they see it as part of their training program, something like that.
Yeah.
I don't even know if our consultant counterparts are paid. I'm not sure. So for my university, the one I work with, there's a slightly separate budget for the primary care aspect, so for GPs who are actually examining. So it works a bit differently in different universities. So again, try and find out and get involved and see what it entails.
Just imagining what your schedule looks like.
I know. So it's almost like a portfolio career, but it's quite packed. And my wife still wonders how I manage all this.
So typically, this is what you refer to like as a portfolio GP, right?
Yes, I think so. I think that's what it is. Yeah.
Okay, it's now beginning to make sense to me. I mean, looking at primary care now, I mean, you've been in system for a while. How have you sort of seen that evolve, especially looking at family medicine? How has
Mm.
that evolved over the years? Looking at your career and talking about digital, how has that played out in your career?
So obviously the day to day has changed over time. Obviously with the pandemic, with the workload crisis and workforce crisis. So a lot has changed, but we still keep going. How has it played out? The first thing I would say is given the opportunity to specialize again, I will pick being a family physician. I really love being a GP. So that's the first thing I would just clear in the air. Some days it's a hard job, clearly, but nothing beats that doctor-patient relationship that you build over time and that trust and continuity of care. So those are the bedrock of things. Now, going to how things have changed, I think the concern and worry is that foundational doctor-patient relationship, building up of trust and continuity of care is being, for lack of a better word, damaged in many aspects. Not enough appointments for the patient, the very long waiting list, and they're really frustrated circling back to their GPs. Um, Obviously, not enough funding in primary care. Now, some will then argue the pandemic and digitalization of the
Yeah.
appointment systems, for instance, remote triaging and stuff like that. Even if some of that used to happen even before the pandemic in certain settings, obviously with AI coming in and all that. My belief is times are changing. We have to move with the times, but we have to try and hold on to that precious doctor-patient relationship-based care, some would call it, that building up of trust between GP and their patients and the continuity of care. And I think we can leverage and harness whatever digital tools we have these days or that would come in the future that would work hand in hand to bring about the very valued patient-centered care we always dream about.
Yeah. Talking about digital now, so what kind of tools I know in different practices are introducing different things to sort of help them, improve their efficiency and all of that. In your own practice, what kind of tools are you guys sort of looking at or using at the moment?
So a lot of practices over the past few years brought up this, some would call it an e-consult. So I don't know how your practice works, but the one where you have to contact your GP, you have to put in a form or type something online. The phones are hardly ever accessible or used. For us, we use what we call Ask My GPs.
Okay.
That's the digital avenue. So they put in their information, put in the problem, put in what type of appointment they would prefer. Is it urgent or, when are they available, all that kind of stuff. So that comes through to us, mostly the duty doctor or the on-call GP, and they look through it, triage it, and then send an information or send a message to the triaging team admin or patient coordinator, whatever, patient navigator, whatever, and say, okay, book with this, book next week. So we have that remote triaging system using that tool. I don't know if you've heard, so there's word saying by October that that forum or that platform has to remain open from 8 to 6:30. So I think at the moment it's open for a few hours until the practice hits capacity, stuff like that. Yeah, so that's there. The other one, obviously, where a lot of practices, some are using, some are experimenting, some are waiting, is the sort of the scribing, AI scribing
Ambient
tools.
scribes.
Yeah, where you're having your conversation with the patient and it's helping you document whatever you're saying and stuff like that. So there's a few bureaucracy and governance things going through. So in our patch, they've asked us to hold on, not to use it. Some had already started experimenting, but they said, hang fire, we want to go through the governance properly before we launch it. So I think some people say that would be a game changer. Personally, I'm looking forward to using such tools in my consulting room.
Yeah, GP practice. Well, it's fine. So looking at your influence sort of in GP education, in leadership, what kind of legacy do you hope to leave?
Oh gosh, I don't know if I've thought about that yet. Well, I hope to keep inspiring people, friends, family, colleagues, peers, that it's possible. I hope to keep inspiring people with my fantastic smile. That's, irrespective of what life throws at us, there's always a way forward and a way out of it. Just keep going, be there, be present, do your best, and help others. I think that's kind of my mantra, I think.
Yeah. I mean, your journey, yeah, we've, explored a little bit of it really because we could spend hours here looking at everything. I know you've
Precisely.
probably gotten your highs and lows, right? So if I was a new doctor, new GP, who's trying to navigate the system, what kind of, would I say, pitfalls or challenges would you say I should try to sort of avoid based on your own experience?
Yeah, so but my experience and maybe obviously talking and working with other colleagues. So I
Yeah.
think one is speaking up early. If you're going through a challenge or you're even considering getting involved with something, don't keep it too late. Don't wait for it to progress too much. Speak up early. Don't be shy. There's nothing like a stupid question. We've all been through it and we're here to help each other. So speak up early, reach out on time. And now if the person is not able to help or support, they may be able to signpost you to something or someone, or there's another person you can reach out to. But speak up and talk about it on time. What else would I say? I think it's good to plan. It's good to plan. It's good to be organized. I personally am not too much into the where do you see yourself in 5 years, 10 years type of thing. I always just take each day, each month, each year
One
by
day
it
at a
comes. But
time.
yeah, but actually sometimes you may have to try and plan a bit further, particularly if you have a family, for instance, or if you're thinking about getting into certain spaces, whatever it is. And also if you want to be able to plan your finances, these are important things that are, yeah, not medical, but they're important and relevant.
Yeah.
So try to be a planner, try to be organized. I know that sounds a bit vague, but it's important.
Okay. So planning is very key. I mean, because you talked about those four boxes that guy mentioned, different boxes. And listening to you describe your journey, you sort of been following, trying to fill all those boxes one after.
Literally, yeah, literally.
Exactly. So that sounds like a plan to me anyway, that you had to move in blocks or something just to
Yeah,
fill in all those gaps to
yeah.
bring everything together. Then just wrapping up, I mean, it's been an interesting conversation trying to look at your experience, share your highs and lows and all of that. Now, as a portfolio GP, right? I mean, you've even sold that if you're going to choose any specialty, you still come back to family medicine. So some people will argue anyway, but that's fine. So looking at your career now as a portfolio GP, right? If someone was to ask, is this something I should consider? I've been seeing lots of posts. I'm not a GP myself, so I don't know what happens there, right? So I see posts, people are saying, don't just be like, what I call a straight jacketed GP, try and become a portfolio GP, really. So
Mhm.
what's your take on that, looking at, all
Yeah,
you've done
yeah.
so far?
So Dr. Ron, even if we don't say it or tell people,
Yeah.
it's already happening, and a lot of people are already doing that and having to do that. For me personally, I don't really see myself being in the GP practice 5 days a week or something like that. I think I might burn out, to be honest. It's not because I'm lazy or I want to work part time, because it's not really part time. I think I'll burn out, I'll be honest. But also, it makes your job and career and profession a bit more interesting, for me at least, and I think for many other colleagues, if you mix it up a bit. So you're doing other things, either mentoring or teaching or being part of an organization or a body or in leadership. So I think it's good to mix things up a bit, and it may come around to even make you a better clinician, because you're seeing various aspects of the profession and you're not getting burnt out. I
Yeah.
think definitely, I think that's the way a lot of people are going, particularly sort of early career, mid career GPs. I think that's the way many are going these days. And some may also argue that the general practice has changed over. So general practice 10 years ago, the kind of patients you see, how much you needed to do in each consultation
Yeah.
has sort of increased. We're seeing a bit more complex multi comorbidities and all that kind of stuff. Social determinants of health, social prescribing, all that kind of stuff. So some would argue that it has actually changed. So it's actually reasonable to, maybe do a little bit less and mix in other things.
Mm-hmm.
Yeah. So that might take. I think go for it. Go for it. But always remember, don't do it because others are doing it. Don't do it because others. Just think about what works for you,
Yeah.
and then go for it.
So one final point that I haven't explored really. So I mean, we're looking at the whole, career path and all of that. So on the family side, I know getting that balance is really critical, right? And also having that support on the family side to be able to do all of this is really key. How has that played out in your own experience?
So that has been a journey, an interesting journey, actually. And I think one of the real reasons I was able to get involved with a number of these things, particularly with the college, is because when it first started, a lot of it was done on Zoom. So I'll just be at home in the evening and I'll log on to Zoom.
Yeah.
But even that started to become a bit of a challenge, because that's taking you away from the family,
Time.
isn't it? Time. So, but you just have to work together as a family, isn't it? Work together as a family. If it's something that, obviously, I'm not here to advise you on your marriage and your family, but if it's something that is starting to hamper on that,
Yeah.
think about it, weigh it up. What value is it bringing? What value are you giving? Is it something that can wait? Is it something that you can do at the latter part of your career? So for me personally, I always like to check in with my family ever so often.
Mm-hmm.
In fact, what's I've started, or we've started to agree to try to do now, is maybe if I'm going for a meeting or conference, maybe we all go as a
Go
family.
together. Okay.
For instance, yeah, to go for some people do that. We all go together as a family, so that sort of helps that bonding, to be honest.
Mm-hmm.
But I always check in. Another thing I've started, like I mentioned, that value. I've started looking at, which I reassessed quite. I know sounds like I'm doing quite a lot, but I actually tried to reduce the things I was doing over the
Yeah.
past few months, because I had to, particularly being chair, I had to weigh up, okay, what responsibilities can I just part with for now? And what do I need to focus on? So you always have to reevaluate from time to time.
Mm-hmm.
If possible, reevaluate with your family.
I like that, with your family. Joint decision making.
Yes, 100%. Very important. Very important.
I think that's very important to sort of highlight because I mean, most of these journeys on the surface, it looks, very smooth sailing, but a lot of people forget that other bit where, especially for those who's got family, that
Yeah,
part is also very critical and you need to just sort of find a balance so that you don't, in quote, scatter things.
100%. 100%.
So just wrap it up. Any final words for people who are watching, listening that they can part
So,
with? Yeah,
yeah. So,
words of wisdom.
firstly, Yeah, firstly, fantastic job you're doing, Dr. Ron. Fantastic. Your consistency is close to nothing.
Thank
So,
you.
keep subscribing, everyone. Keep sharing the posts. We're always learning. We're on a learning journey and we're
Uh-huh.
helping and supporting one another. So the other thing I would say is reach out to Dr. Ron, reach out to the guests that have been on his podcast. Ask your questions. Some people say closed mouth is a closed destiny. I don't know how true it is, but reach out, ask questions. That's the way we learn and get information to move ahead. But
Mhm.
thanks for having me up. This has been an exciting session, to be honest.
So I think that's another way of saying your DMs are open on LinkedIn for people to
Well,
send
yeah.
you
Well,
messages.
I'm on LinkedIn. I'm on Instagram. Yeah. So yeah. If you have any questions, by all means, reach out to me.
All right. So I mean, it's been an incredible journey. We've just listened to, from his beginnings in Nigeria, into the UK, navigating the challenges of a new healthcare system, and eventually becoming a leader, mentor, and a chair. It's just a powerful reminder of the impact of resilience, purpose, and service. So if you're watching, if you're listening, I hope today's conversation has really inspired you. So whether you're a doctor in training, whether you're an international medical graduate or somebody who's just curious about, the future of primary care, becoming a GP, portfolio and careers and all of that. So I hope you've learned one or two things from there. So, like he said, if you've enjoyed this episode, please don't forget to subscribe. I don't say this all the time. I probably should say it more like other people, but please don't forget to subscribe to the podcast, leave us a review, or share it with someone who you think will find value in this story. And you can also connect with me on LinkedIn. I'm on LinkedIn. You can connect with Dr. Uwa on LinkedIn. He's already said that his DMs is open, so you can send him questions. And basically, let's just join the conversation about building meaningful careers in healthcare. So thank you so much more for tuning in. And until the next episode, like I keep saying, keep learning, keep growing, and keep shaping the future of healthcare. And I'll see you guys. Bye for now.